Hi there and welcome to the Dawn Show. Dawn Stensland-Menti here. Today, part 2 of our breast health series. Today, breast treatment and diagnostics. This is so important. We have two of the best doctors in our area on breast health here. Dr. Carruthers, Director of Breast Health Programs at Holy Redeemer Health Systems, and Dr. Beth DuPree, Medical Director of Breast Health Programs, Holy Redeemer Health Systems, and the author of a great book, The Healing Consciousness, A Doctor's Journey to Healing. It is a wonderful book if you haven't read it. So thanks for coming back.
Thanks for
part
having
2
us.
here. So tell me about, when you talk about diagnostics, and we want to get to, the treatments and all of that, but why is it so important for women and men to go through the screening process?
Well, what we know about screening for breast cancer is that we can help prevent death from breast cancer. So screening doesn't prevent breast cancer from occurring. I have a lot of patients who come to me and they say, but Dr. Carruthers, I had my mammogram every year and now I have breast cancer. Well, I wish that we had something that we could do to your breast that would keep you from getting breast cancer, but unfortunately we don't. So what we know about mammograms is while they don't keep us from getting breast cancer, they do help prevent death from breast cancer.
So what's real-time screening?
Real-time screening is a program that we initiated at our Women's Care Center at 45 2nd Street Pike with Holy Redeemer Health System, and it came out of a need to give women definitive answers in a timely fashion. And one of my sisters had a mammogram several years ago, back before I was even a so-called breast surgeon. And here's a woman who's head of a company, runs a multi-million-dollar organization, and is on the phone going, they told me I have a speculated density. And I'm like, all right, pick up your films, get in the car, drive down, and I have the ability to get her in, do the diagnostic mammogram, get the ultrasound, and find out that she's okay. Just happened to me again this past Thursday with my niece. And I said, okay, ladies, here's the deal. You need to drive to our facility because you can schedule what we call a real-time screen, which means when you come in for your exam, you bring your old x-rays, your old films, you get your mammogram performed, you see the eyes of a radiologist that looks at you and says, hey, Dawn, everything is great. See you next year. Or, hey, Dawn, listen, I saw a little shadow in your mammogram. I'd like to do an additional view. I'd like to do a compression view and an ultrasound. And through that process can help you identify whether you have a problem or not. And it doesn't make you not have a problem, but if you do have something, let's say you had a density, the radiologist would come and say to you, Dawn, you have a density, it needs a biopsy, and introduces you to Amy, our nurse navigator. So then Amy comes in and says, hey, Dawn, do you have a surgeon that you go to or that you'd like to see? And you say, no, but I do know these great doctors, Dr. Carruthers and Dr. DuPree. So then she walks down the hall and says, when can I get you in? So what we've done is we've taken what can be a really scary process, and what women don't understand is until you have your first abnormal mammogram, you breeze in for your mammo, you get your screen, you go home. It's not till you get that awful letter in the mail that says, oh, you have something, call us and we're going to reschedule your additional tests, because that's when you realize that if you knew that you could do real-time screening, you come in, you get it done, you get an answer, and you get on with your life.
So it's one-stop shopping, in
Correct.
other words.
Right.
You have everybody in-house, and then you get what you need, and you go, it's expedited.
Right. And one of the things that we just started last year was what we call 3D tomosynthesis.
Right, and so 3D tomosynthesis is one of the newest forms of mammogram. The standard mammogram basically gives us two pictures of a breast, right? So you have up and down, a side view, so it's a 2D look at the breast. The tomosynthesis allows us to have a 3D look at the breast, which gives us, even in all types of breasts, it lets us see things better. It reduces our need for calling people back for things that don't exist, so it reduces anxiety associated with mammograms, and it helps us pick up more cancers that are often smaller than what we would have found on the standard mammogram.
Are there risks to some of these? You hear about people saying, oh, it's radiation and it's a risk. Is there a risk to the test?
There is a dose of radiation given with every mammogram, with every 3D mammogram as well. So the 3D mammogram does have a little bit higher dose of radiation, but what we usually say that a mammogram is basically equivalent to flying across the country in a plane. Do you ever get on the plane and think, oh my gosh, how much radiation am I getting? No, you don't. You think, where's my drink? Where's my book? Where's my pillow, right?
And now where's my iPhone?
Where's my iPhone?
Absolutely. So it's controversial right now that we're hearing about government guidelines. And this is my sister-in-law, one of my sisters-in-law came and said, oh, her doctor said it's all changing in the coverages, and because of her age, they've said, oh, well, you're only going to need a mammogram every couple of years. How does that make you as, breast surgeons feel?
Well, in 2009, the United States Preventive Task Force came out with their recommendations to, number one, change mammography screening from age 50 to 70 every other year. And currently, the American College of Surgeons, the American College of Radiology, almost every governing body run by physicians who treat breast cancer recommend a baseline somewhere between 35 and 40 and annually from 40 on. So this change from 50 to 70 is more of what we tend to see in countries that have socialized medicine. So every other year from 50 to 70, they recommend against clinical breast exam. They might recommend against breast self-exam, which we tell our patients, you should be doing a breast self-exam because there are portions of your breast tissue that's not imaged because, like Dr. Carruthers said, it's a three-dimensional organ in a two-dimensional x-ray. So areas high up on your chest wall, laterally in the breast and below the breast and in by your sternum, you're not going to be able to see on a mammogram. So we do think that the breast self-exam is an important part. So when those recommendations came out, there was a lot of pushback. Yeah. It was a big deal. I ended up on a couple radio shows and TV shows because of it, because obviously I have an opinion. And
Hey, let's talk about this controversy. Let's take a quick break.
Perfect.
And we'll talk about this controversy. That's going to get mad. Coming right back.